Testing, testing. All right, we ready to go? We good to go? I have my Argentina cup, and I have my my big gulp. This is not a coffee cup, guys. This is my dad's ice water container. You can see the ice water there. My dad wouldn't be found without this. But when he passed away, I decided to take the mantle of the gigantic cup and carry on the tradition of drinking large quantities of ice water, which is also a very strange thing in China to have ice water. Anyways, let's get this show on the road. As an American, I've always identified with exceptionalism, at least when I was younger. There was this sort of air of superiority that Americans had because we were the land of the free and the home of the brave. I grew up thinking that America was the bee's knees, and in a lot of ways they are, but in a lot of ways they've lost some of that. And this virus has revealed an example of this that is very, very stark and very, very evident and extremely tragic. I've been wanting to talk about this for a long time, actually, because honestly, it bugs the living shit out of me. Exceptionalism comes at a price, and that price in often terms is integrity. Integrity is trying to do the right thing as much as possible, but also admitting when you do something wrong. Admitting that you could have done better. Oftentimes, you could admit to something that's frivolous. We should have paid back some more money, or we should have done something like this. It typically doesn't involve human lives or tragedy. Not in this case. In this case, America really messed up. And it cost a lot. It cost lives, it cost finances, and it cost the standing of America in the years to come. I feel like America's standing in the world has been on a downward trend for the last 3+ years, intentionally, which is crazy for me. But we'll get into globalization in the next podcast. Right now, I want to talk to you about South Korea. Why South Korea? We've heard in the news a lot about how South Korea has been handling this virus and how America has not been handling this virus. South Korea is an excellent benchmark to judge America. As a matter of fact, I had a lot of my friends in America who are like, Matt, you shouldn't talk in such what-ifs. You shouldn't be extrapolating things that did not happen and saying, what if America did it differently? What if? I like to discuss what-if scenarios. I think it's very good as an analytical way to look back and rehash and try to do better. I do what-if scenarios for myself all the time. All the time. What if I would have done that different? What if I would have swerved left instead of swerved right? It's helpful. It's also helpful in these videos because I'm an evolving person and I take new information if it comes my way, and it evolves what I think. And so if a weird bit of information comes later, I say, what if I had that information sooner? How would that have changed the outcome? But South Korea, let's get back. You know what? I was going to do all sorts of interesting things. I had planned to do like a comparative analysis. I planned to discuss the entire America scenario from the standpoint of what would they have done if they were doing the same things as South Korea. It got a little muddled because I wanted to talk about some hypothetical scenarios, but also I wanted to bring in real-life scenarios. So let me start with the numbers, because they are crazy. South Korea has a population of 51.64 million. United States at the 2019 benchmark has 328.2 million. numbers aren't that important. Just know that when I upscale any numbers per citizen or like population numbers or any sort of ratio from South Korea to the United States, I'm increasing it by a factor of 6.36. The rest is pretty identical. They have a large religious sect. That will come into play a little bit later as we talk about the timeline. South Korea has a two-party system, a right and a left. They carry a lot of the same values as they do in America. Maybe a little bit less corruption, but not less craziness. As a matter of fact, South Korean government and South Korean people sacked the last president because she had some really crazy ties to some really crazy places. It's an interesting story. You should check it out, but that's not what we're talking about right now. Just know that their government is crazy, just like our government is crazy. During the pandemic, or during the epidemic turned pandemic, they were dealing with an election, a lot like America was dealing with the Democratic primaries. The demographic is similar, the breakdown of people and the affluence of people. There are very rich people, there are very poor people. They have a city called Seoul, which is as busy and modern as any American city, if not more. In fact, I would probably lean towards if not more. They have wet markets, they have skyscrapers, they have big, huge, monolithic businesses, and they coexist together. So it's a very interesting thing. To the south, they have a city called Busan, which is sort of like your prototypical beach city. It's very cool, very relaxed, very modern. Reminds me of Miami. They have an island called Jeju, which would replicate or simulate Hawaii. They are a high-debt society. As a matter of fact, after this whole pandemic, they're going to have to grapple with debt similar, but not to the extent that America has gone through things. So in that way, they're very similar to America. Their manufacturing sector relies heavily on China. They are home to Samsung and many huge companies that supply products to the world, a lot like Apple does. But many of their component parts are made in China, so they have this sort of reliance on Chinese manufacturing. The middle waste of the country has farmland, beautiful rice fields and grains and corn, a lot like Middle America. Why do I know this? Because I actually cycled the length of South Korea on my recumbent cycle tour. I'm cycling around the world. I'm normally not doing these sort of commentary videos, but in this case, we're all sort of landlocked and locked in our prospective apartments. I'm in China, south of Shanghai, in a city called Ningbo, which is quite free, quite open, but the world is closed down. So if I'm in a house that is completely open, but all of my neighbors and businesses are locked down, guess what? I'm locked down too. So we're all sort of trapped here in this weird moment in human history. So yeah, I rode across South Korea. I've seen it. The big differences is language and a little bit of culture. But for the most part, you can draw a lot of similarities to the way that South Korea is run with the way that America is run. So I'm just going to do a spoiler alert and go to the end first, because this might be a long video, and I want to give you guys the crux of this entire argument before I go through the timeline, so that maybe you don't have to scroll all the way to the end if you think I'm boring. But this isn't boring. This is important. And I don't think enough people realize this. With all the similarities that South Korea has with the United States of America, upscaled by a factor of 6.36, today, May 10th of me recording this, the United States has 1.345 million cases of COVID-19 and 79,997 deaths. That's just insane. And it's not insane just because the number's high. It's insane because we don't live in a vacuum. The United States didn't catch COVID-19 alone and we're all watching them like some movie and we're all eating popcorn. What's happening in America? This is happening everywhere, which is why I bring up South Korea, because devoid of the vacuum, we should be behaving a lot like South Korea. South Korea, as of today, has 10,840 cases of COVID-19 compared to our 1.3 million. As of today, 256 South Koreans have died. Let me rephrase that. 256 humans in South Korea have died of COVID-19 as of today. Now, obviously, the country's a lot smaller. They're smaller by a factor of 6.3. So let's increase their numbers by 6.3 and see how close we come to America's numbers. Again, 1.345 million in America. If you increase South Korea's numbers, they have 68,292 cases of COVID-19, and they have lost 1,612 humans to the disease. Do you understand the levity of those numbers? Basically, what I just said is that with the exact same disease, the exact same China, the exact same cover-up, the exact same problems, the exact same situation, 78,385 human beings in America died as opposed to the equivalent population in South Korea. Is that acceptable? Is that the fault of China? Is that the fault of anybody but mismanagement of this crisis by the people that we depend on to watch over us and make sure that we have a well-running machine? Is that American exceptionalism? That's a fucking shame is what that is. That's unacceptable is what that is. That's the fault of people high in the administration in America making foolish decisions at late time scales, which I'll get into later. But I'm in China. I understand the virus came from here. I understand that they didn't start this thing perfectly. But think about that for a second. Let's talk about some more numbers. So to every one Korean death, every one human in Korea that died, 48.6 Americans died. Wherever you are, think of your room, sitting down, watching this video, wherever you are. Put 50 people in that room with you. They're not in the room with you anymore. They are in Korea. They're in that room. Let's talk about money. South Korea and America. So as of today, the latest numbers I can find, South Korea invested $200 billion to rescue their country, or at least maintain the status quo and make sure that people don't suffer financially. If you want to think of that as an upscale, because the amount of money you spend for the population in Korea is going to have to go up if you have 6.3 times the population. So let's increase that. So upscaled at a factor of 6.3, you have $1.26 trillion spent. That's a lot of money. In fact, that's a lot of money more than I did in my research. I just came across an article that was more up to date, and they invested this added amount. They had been investing like $80 billion, and so they upped it recently to help out small businesses, big businesses, to help out typical South Korean citizens. So they're trying as hard as they can to make sure that everybody is weathering this storm as good as possible. What about the United States? What did they have to fork over in order to maintain some semblance of normalcy, to keep people's heads above water? Well, everybody's heard about this $2 trillion stimulus package. All told, it was about $2.2 trillion, and I've even seen numbers up to $3 trillion when you include other budgetary measures. What ramifications this has to the world, let alone America, have yet to be sussed out. As a matter of fact, America's economy tends to not reflect the severity of what's going on, a lot because of this stimulus package. But I'll digress. I'll talk about that in some future episode. I have a tough time with numbers sometimes, and I like to break them down in chunks that I can understand. Well, to put it into context, $940 billion into a population of 328.2 million. That's like going up to every American and asking them to fork over $2,864.10. That's how much more United States has spent to rescue its economy and provide for its people than South Korea has. That money doesn't have anything to do with the origin of the virus. That number, that increase from South Korea has only to do with mismanagement. Does that make you angry? It should. This whole thing is going to bankrupt America. If it hasn't already. The cascade snowball effect of what's going on right now is going to ripple across the world, a lot like Krakatoa. When Krakatoa erupted, it was the loudest sound ever recorded in human history, and the sound ricocheted around the world numerous times. It was so loud. If you were 100 kilometers away, you lost your hearing. Some people lost their eyesight. If your eyes were open, they would bust out of your face.
The shock waves from the explosion reverberated around the globe 7 times and were still detectable 5 days later.
This is the Krakatoa-sized mess up. The virus is bad. Don't get me wrong. It's a tragedy. But management of this virus by a lot of Western countries, it's not just the United States, is an equal tragedy. And we're all watching it happen. We are in a unique point in human history where we can watch this thing happen. People are hurting. Let's just think again about people hurting. Unemployment. Have you lost your job watching this? Are you worried about your job? I know a lot of people are. A lot of people can't sit in front of a microphone and talk to a YouTube audience. They're worried about more important things. People that are working are essential workers, and their lives are in peril in a unique way. And Jayo to all of you guys working hard to provide for everybody, feed everybody. Thank you. Your service is invaluable. As of right now in the United States, there's like 14% unemployment. That's going to go up. That's just people that have filed unemployment. That doesn't include people that are working off the books or for cash or in certain service industries. That's just people filing for unemployment. South Korea, on the other hand, mind you, has a 4% unemployment rate as of January. That was the peak, from what I could tell. 4% unemployment. So 10% of America is unemployed as a direct effect of the actions or inactions taken when you compare it to other countries that we should be right on par with. I had a conversation with a friend yesterday. He's like, well, South Korea is advanced. Well, South Korea, it's not like us. They had SARS. They dealt with viruses, and they were prepared for this. Not like America. America wasn't ready for this. Do we live on a rock in space? America is separate from South Korea, separate from China? No, we exist in the same place. So, I mean, America should be learning the same lessons, and in most cases does learn the same lessons as every other country. As a matter of fact, we often pioneer these lessons. We shouldn't be looking at the world and saying, well, they're better than us. We are Americans. Well, unless you're not Americans watching this. We were born of the greatest country in the world, we were taught. So the argument, they did it better because they were more prepared and they learned lessons from history. That's not a valid excuse if that's the excuse you want to give. We should be on par with South Korea. If not, maybe a little bit behind due to some cultural differences like not wearing masks or not being comfortable. But Even wearing masks, I think, would have been something that we would be more accepting of as Americans if our president would wear a mask.
This is voluntary. I don't think I'm going to be doing it.
The mask situation is very interesting, actually. There's a lot of arguments and blame game going on with that. But again, the facts are what the facts are. And if you've been watching up until this point, you basically have the crux of the argument. The comparison between America and the United States is really different, and it is a direct cause of the mismanagement of this thing. It's very easy to see. That's not me making an assumption. This is easy to see. Let me go into this next category, and it includes the masks. Why weren't we more prepared as Americans as opposed to South Korea? I'm going to get into some facts, and then I'm going to get into the timeline of what South Korea did step by step that prevented them from having our American result. Hopefully, it can help you understand this thing. I'm going long form at this because I think it's important, because it has astonished me. Before I get into the timeline, let's talk about the setup. America has a national stockpile. It's masks, it's respirators, it's medications, it's any sort of emergency care supplies that are used in natural disasters or emergencies. America has used it in a number of occasions. We've used it for the 2009 H1N1, the swine flu, the SARS, the 2016 Zika virus, the 2014 Ebola scare, and the botulism outbreak. Hurricanes Alex, Irene, Isaac, and Sandy, and even flooding in 2010 in North Dakota. And seeing as though we used it so many times, we knew that it was important to keep stocked up.
So I knew when I returned to HHS last year that my position would demand thinking about how to keep America and the world safe from all kinds of health threats, especially infectious diseases.
But the priorities were not there. The concerns were not for stockpiles, they were for tax relief.
Great plan. It's going to put people back to work.
And so the job of restocking the national stockpile went into the dustbin.
President Trump's proposed budget plan could threaten America's ability to fight health threats.
Tom Bossert, in 2018, the Homeland Security advisor, he left. He was unable to help in a pandemic that his job was designed to help in, and he was not replaced.
At this point, we need to look clear-eyed at the fact that we might have a devastating pandemic influenza, and it's high time that we have a biodefense strategy to address it, and this administration is going to create one. I'm going to lead this as a coordinating matter for the president, but we then brought on a guy named Admiral Tim Ziemer, and for those of you that don't know him, he's the right guy. He should be all the evidence you need that this administration takes seriously not only biodefense, but the global health security agenda that President Obama promoted. This is a problem that you can't fix by shutting down our borders or controlling our entry.
Tom Ziemer, the NSC Senior Director for Global Health Security and Biodefense, he left his job. He was never replaced after 2018. Dr. Luciano Borio, the NSC Director for Medical and Biodefense Preparedness.
I've dedicated my career to preparing for epidemics. An epidemic can tear apart the fabric of our society. And Ebola in particular is a cruel disease.
The Global Health Security and Biodefense Agency was shut down. Funding for the CDC's global disease outbreak prevention efforts had been reduced by 80%.
Where we are right now is that everybody is recognizing, oops, it was a big mistake by the Trump administration to obliterate the entire infrastructure of pandemic response that the Obama administration had created.
That's not to say that America didn't have anybody in China. There was quite a few people in China that were raising red flags, and you could even turn on the news and see what was going on in Wuhan. So this, again, did not exist in a bubble where we were all engaged in it. As a matter of fact, I was here in China during the original outbreak. Morning, guys. You were looking at a live stream of the hospitals being built in Wuhan. That's actually 62,759,000 people live streaming, watching that simultaneously. So, that is the setup. Let's start looking at what America did, what South Korea did, and what the world was doing and what China did, and see what comes out of it. December 25th, 2019, China. Wuhan medical staff in 2 hospitals detect suspected pneumonia. This has been debated. It's going to continue to be debated. I'm not going to go on too much information other than the information I have in front of me. But saying that, from this information that we had, South Korea acted. So actually the timeline is quite good. December 31st, 2019, Wuhan has a cluster of new pneumonia cases. It's growing. So we have the first few clusters of pneumonia cases. January 3rd, because South Korea has people on the ground in China investigating potential outbreaks, which America should have. Their CDC in China shares pneumonia outbreak information with teams in South Korea, and they start enhanced quarantine and screening measures for all Wuhan entries. Have you been close to anybody infected? Do you have a fever? Do you know of anybody who has pneumonia symptoms? If you do, we're going to quarantine you. These steps were taken before even WHO really made a public statement. Because January 4th, the WHO did make a public statement on social media. They said there's a cluster of pneumonia cases, no deaths yet, in Wuhan, Hubei province. However you think about the WHO, this is an actual episode I want to make in the future. Their job is to let us know about global health emergencies, and we should be somewhat appreciative that at least they're there in some capacity to let us know that something's going wrong. 2 days after that, on January 7th, the WHO labels it the 2019 nCoV. January 10th, the WHO issues a package of tech guidelines to all countries on how to manage potential cases. So WHO now has put out a statement on social media, has released a statement, has labeled it 2019 nCoV, and issued a guidelines package to anybody that might be interested. Hey, we got this new pneumonia. We're not sure what it is. It's novel. All of this stuff has done in fairly rapid succession for all countries to see and judge. South Korea at this point in this race between America and China has even been before the WHO has really promoted this in any way. Good on you, South Korea. January 11th, China admits that a 61-year-old man in Wuhan died on January 9th from respiratory failure and severe pneumonia, most likely in connection with this novel coronavirus. The next day, January 12th, China shares the genome sequence of COVID-19. So January 12th, China submits for the whole world to see the genome sequence of COVID-19 so other countries can take that genome sequence, study it, develop vaccines, develop treatments, understand the disease better. This was done. I'm honestly not saying this as a pro-Chinese stance. These are facts, okay? Maybe they should have put out the genome sequence earlier. You want to argue that? That is fine. But on January 12th, they shared it with the world. And so at that point in time, we had the operating instructions for that VCR. I mean, we should have been able to do some things with it. January 13th, the next day, the first case of COVID-19 is detected out of China in Thailand. Again, this timeline is existing at the time it existed. So this is what we knew back then. Today we know potentially it was spreading around Europe. Potentially there were cases in the United States. Potentially there was cases all over. They're being investigated. And due to antibody testing, we can kind of see that some of these people actually had it long before. We'll let that information still stand. We'll discuss that later. But as this sits, this is the timeline that we had at that time. And this is what countries did with that timeline at that time. January 20th, South Korea detects the first case of COVID-19.
Our top story this morning, the first case of a mysterious SARS-like virus that emerged in China last month has been confirmed here in South Korea.
The Republic of Korea government updated its infectious disease alert national crisis management system from blue to yellow. So they have this sort of tiered, like America's terror level, red, orange, green, so they updated their system from blue to yellow. When they did that, all individuals traveling to Korea within 14 days of visiting Wuhan were required to submit a health questionnaire and report fever or respiratory symptoms to a quarantine officer. Hey, sir, have you been to Wuhan, China in the last 14 days? The next day, January 21st, in America, U.S. officials in Washington state confirmed the first case on U.S. soil.
The U.S. has confirmed its first case of the Wuhan virus, and authorities are expecting more cases to emerge.
So this is a very, very important point. Now, on this whole timeline, America and South Korea started at the exact same time, basically. One day, but time zone-wise, let's just say it's basically the same day. Hypothetically, we should be able to follow the same guidelines as South Korea in containment measures and control of this virus around the United States. It's a pretty safe assumption to make. But as you're going to hear, it doesn't really go that way. The next day, January 22nd, the WHO mission to China issued a statement saying that there was an evidence of human-to-human transmission in Wuhan, but more investigation was needed to understand the full extent of the transmission. South Korea had people on the ground over a week earlier investigating and coming up with their own assumptions. They weren't depending on the WHO to tell them anything. They weren't depending on China to lie to them. They were doing their due diligence as a modern society to take care of their own citizens, regardless of what was being said by WHO or regardless of what was being said by China, for that matter. On that same day,
the CDC has identified a case of coronavirus in Washington state. If you remember SARS, that affected GDP. Have you been briefed by the CDC?
I have.
Are there words about a pandemic at this point?
No, we're not at all, and we have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine.
Well, it's not going to be just fine. If you were watching Wuhan, you'd know it wouldn't be just fine. If you were talking even to our allies in South Korea, you'd know that it wasn't going to be just fine. And by saying it was going to be just fine, you start to plant the seed in normal Americans' heads that it's not going to be a big deal, and we don't have anything to worry about, and we shouldn't at least take beginning precautions for this potential outbreak. On the 24th, 2 days later, Trump praised China for its efforts to prevent the spread of the virus in a tweet. He seems to think China is doing a bang-up job. I was here in China during that time, in Ningbo. We are all carrying around an honorary bottle of disinfectant spray, and we spray everything. That is very, very key. Spray the hands, spray the underside of your shoes, spray doorknobs, spray any buttons that we plan to press. That is definitely something that we've adopted as a tactic if we do want to go outside. Everybody mobilized, everybody wearing masks, everybody's in their house on voluntary lockdown or enforced lockdown, depending on where you are. Wuhan is exploding and preventative measures are being taken. It is quite an amazing thing to be on the ground for, and quite an obvious thing to see on the news every day when you turn on the TV, and basically China is imploding in front of our eyes with something we've never seen before. 3 days later, on January 27th, the South Korean government upped its alert from yellow to orange. At a train station in Seoul, South Korean health officials convened representatives from over 20 medical companies to discuss the urgency of effective tests and guarantee expedited regulatory approval.
Seoul's defense ministry said on Monday that it will mobilize some 100 military doctors, nurses, soldiers, and dispatch them to 21 seaports and airports across the country.
So at this point in time, a lot like America eventually did, South Korea thought, let's involve the tech sector, let's involve industry, let's put all of us in a room, let's hash this thing out. It's not an I alone can fix it scenario. It's a let's work together and solve this problem scenario. And so they started working on testing. On January 29th, the Korean CDC opened welfare offices all over South Korea and tried to help people who might be becoming affected by this. So they were accepting consultation calls. What do I do about this virus? I'm a little bit afraid. How is my business going to deal with this? What are we doing? What are we doing? And so they created offices all over South Korea to facilitate and help ease people's worries with regards to this virus. They were saying it's serious. They were telling their citizens, you need to worry, but they were also putting systems in place so that that worry could be channeled in a positive way so that people could know what to do in certain circumstances. So at this point, January 30th, South Korea sends 250 professionals to the major entry point into the country to assist customs individuals and people in the quarantine centers to make sure that they're running their program correctly. This is going to be a big sticking point for me as we go forward, because I actually entered America a few days later, and I certainly didn't see what was happening in South Korea. The same day that South Korea is sending 250 people to the Incheon's International Airport, the United States announces the first case of the person-to-person transmission of the virus in the United States. At an Iowa campaign rally, Trump talks about the U.S. partnering with China to control the disease.
And we're working with them very closely on the coronavirus. We're working with them very, very closely. We only have 5 people. Hopefully everything's going to be great. They have somewhat of a problem, but hopefully it's all going to be great. But we're working with China, just so you know, and other countries very, very closely so it doesn't get out of hand.
That same day, the WHO director describes the outbreak as
a public health emergency of international concern over the global outbreak of novel coronavirus.
The next day, after that announcement, South Korea charters a plane from Wuhan and returns with 368 citizens to Korea. 2 of them tested positive for the virus. Also, Korean pharmacies were given the ability to check patients' travel histories through the National Healthcare System's patient status checking system. So this is like contact tracing starting. People are checking travel histories. People in pharmacies were told, you know what, if somebody comes in for medicine, why don't we check them out, make sure they haven't been in Wuhan. If they have, we need to let people know, and we need to kind of get on top of this thing. Oh. Somebody is either opening a business or getting married. We'll take a little break. Only lasts a little while. I think it was a business opening. But anyways.
Factories here in South Korea will be operating around the clock to ensure the face mask supply remains stable. The Ministry of Food and Drug Safety said Sunday that it plans to keep the supply above 10 million a day. Currently, the government estimates some 31 million masks remain in stock.
February 2nd, the next day, the Ministry of Health and Welfare required anyone who had been in contact with patients who had tested positive for COVID-19 to self-isolate for 14 days, and required all travelers from China in the past 13 days who were symptomatic to undergo diagnostic exams. All travelers from all of China, if you were in South Korea, if you landed in South Korea 12 days prior, they would call you up. They would say, how are you feeling? If you say, I don't know, I got a little fever, they would immediately send you to a diagnostic center to get exams. All travelers from China were directed to a separate arrival hall in Incheon Airport and were required to submit their domestic addresses and contact numbers. So at that point in time, everybody's like, you coming to Korea? Where are you coming from? Where are you going? Give me contact information. You need to let us know. Restrictions were placed on visa issuance, and all foreigners from Hubei were denied completely. So anybody coming in from Hubei province, a province of 50 million people, were like, no, not at all. But if you're coming in from areas outside Hubei province, you're allowed in, but you're going to have to let us know where you're from. And in a lot of cases, they were tightening visa issuances altogether, so you weren't able to get in anyways. That same day, February 2nd, an important day for me, Trump's executive order banning anyone who has been in China in the past 14 days went into effect.
The Trump administration says it will now bar foreign nationals entering the United States if they've been here to China in the 14 days before they arrived.
You hope there's enough communication between China and the U.S. and everyone else so everyone tries to get on the same page so it can be contained.
It was Super Bowl Sunday. Trump was interviewed by Sean Hannity and asked,
Coronavirus, Disney's closed. Movie theaters are closed. Hospitals being built. I think we're now up to our 8th case in the United States. How concerned are you?
Well, we pretty much shut it down coming in from China.
You offered the Chinese president help with the coronavirus?
Oh, yeah. Well, no, we're offering them tremendous help. We have the best in the world for that. We've done a tremendous job. But we can't have thousands of people coming in who may have this problem, the coronavirus. So we're going to see what happens, but we did shut it down, yes.
I love sports.
Shut it down. He says that in sort of a past tense. We already shut it down. We shut it down. I flew from Ningbo here to there thinking that America was going to handle the situation a lot better. China was going to possibly lose control. It was, at this point, Wuhan was breaking out and deaths were skyrocketing, and we decided to try to come to America to be safe. We flew into O'Hare Airport in Chicago, where I was expecting questions. I was expecting to see at least the framework of a travel ban coming into place. I was expecting to see police officers and CDC individuals. I was expecting to see signage. I was expecting to see masks on everybody. I was expecting to see people saying, you better put on your mask, you better put on your mask. The entire flight from China was very serious. It was very solemn. Everybody was wearing masks. Everybody was concerned about how this was going to be. But when we landed in O'Hare, which is one of the entry points that were designated as travel ban entry points, we didn't see hardly anything. All right, guys, we are here in Chicago. America, America. That was the easiest customs check I've ever had into America. We did it. Come here. Oh, get down. Oh, big hug, group hug. We did it. We did it. We entered America in probably the easiest entry I've ever had. I've lived in China for 10 years. I've dealt with being pulled aside. I've dealt with extra questions and scrutiny. I've dealt with visa issues and all sorts of stuff. But in this circumstance, we entered the United States. There was a area where you did customs, and there was a long line. Not a lot of people were wearing masks. There was a monitor that was hanging above our heads. That was like an LCD that was doing a cycling message thing, you know, make sure to hold your passport, make sure to have your documents ready. And there was one frame that lasted for about 5 or 10 seconds every cycle. COVID-19 alert from the CDC. If you feel feverish or you have any symptoms, visit a medical professional and get checked out. Very, very, very loose. It was very easy to look over. Scarily easy to look over. This was the first day of the travel ban, and we were entering the easiest entry in the United States I've ever had. When we went up to the customs individual, it was a little nerve-wracking. We were watching different people. We were watching Chinese family enter and exit, enter and exit, enter and exit. And we were wondering what sort of questions were being asked. When we got up with me, my wife, and my daughter, talked to a really, really nice guy. Didn't ask about the virus. Didn't ask where we were coming from. Smiled at my daughter, asked her name. Eva said, Eva Rose. Actually, it was funny. She forgot her name for a second, and she was sort of nervous and tired, and we'd been traveling a lot. And he said, she reminds me a lot of my daughter. Here's your documents. Have a good day. And that was it. That was the Trump travel ban on the first day of the travel ban. I'll leave a link to my trip into the United States. You can watch that video if you want to see what we went through. But that was the travel ban. We weren't instructed to quarantine for 14 days, but we knew it was a responsible thing. And also we were going to go see my family in Detroit. And I didn't want to potentially bring a virus to anybody I care about, let alone anybody in my country. So we went and found an Airbnb, rented one car that we would hold for the entire 14 days. And we did a 14-day quarantine in a hotel for the entire time. And we made sure that we didn't interact with a lot of people. We ordered food in, and we stayed self-isolating for 14 days. At the end of the 14 days, we were good, and we went and visited my family. Now, we had come from a city, Ningbo here, that had very few cases, so the odds of us having COVID-19 were very slim, but we still didn't want to take any chances. Continue with the timeline. February 3rd, the Ministry of Interior and Safety announces it would spend 4.8 billion won, or about 25 million equivalent dollars if you think of it and add the multiplier of 6.3 of emergency aid. The Ministry of Health and Welfare released guidelines on the operation of group facilities and facilities frequented by large groups of people. So they're issuing a guideline book of how people should deal with this virus if they're in large groups, how these sorts of people should act. If you fast forward to today, the CDC is issuing a similar guideline to people on the reopening of America, which I think is too early. And the administration is trying to suppress it. So the CDC had to leak it to the public to try to keep people prepared. So that's a weird comparison. In Korea, social welfare facilities, including daycare centers, senior care facilities, and disability facilities, were directed to temporarily close if they were informed of any occupants or visitors who tested positive for COVID-19 or were in contact with individuals who tested positive. So at this point, Korea is starting to shut things down. They're starting the official lockdown. They are really taking proactive steps. February 4th, the next day, the government in Korea announced the approval of test kits manufactured by Kogene Biotech.
The Korean government has approved the use of a faster way to detect the coronavirus.
Even though the test kits weren't 100% correct every time, they had a fail rate, they circled back and they would do multiple tests. As a weird comparison, the other day, Donald Trump's valet had COVID-19, and he used that as an excuse to say, that's why we don't need tests. One day you won't have it, and the next day you will have it.
This is why the whole concept of tests aren't necessarily great. The tests are perfect, but something can happen between a test where it's good and then something happens, and all of a sudden she was tested very recently and tested negative, and then today, I guess, for some reason she tested positive.
So that somehow means we shouldn't be testing? February 7th, a newly developed test kit capable of producing results in 6 hours was made available at 50 health facilities in South Korea. The daily diagnostic test supply was increased from 2,000 to 3,000, and the number of screening clinics increased from 556 up from 288 set up in January. They're focusing on testing. If you know how many people are sick in your country, you can tackle the situation and understand where the spread is going. 2 days later, on February 10th, Donald Trump spoke at a campaign rally in Manchester, New Hampshire.
The virus. They're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true. But we're doing great in our country. China, I spoke with President Xi, and they're working very, very hard. And I think it's going to all work out fine. Rough stuff, I tell you, rough stuff. But I think it's going to work out good. We only have 11 cases, and they're all getting better.
This kind of makes me think about the instance when 9/11 happened. And the towers were burning. There had been a collision. And Bush, president, was reading a children's book to kids as a photo op, basically. One of his Secret Service walks over, and you can see the video of the guy whispering in his ear, "Sir, the World Trade Centers have had a terrorist attack." He kind of looks around, then he looks down, and he continues reading his book to these kids who have no real understanding of the severity or implications of what he was just told, and he continues reading the book. I always thought that was very odd. I always thought that at that point in time, you'd close the book and you'd say, "Hello, kids. Something really bad's happening in the world. Your president needs to learn a little bit more about it. He's going to take care of it, and you don't need to worry. I'm going to go do my president job. You have a nice day." And he should have closed the book, put it on the chair, looked at the teacher, nodded, and left the room and started tackling this unprecedented attack. And it seemed like what's happening here is a lot of the same thing, just over a longer scale. The 9/11 attack was a single instance, whereas this pandemic has been going on this long way. And what I see happening is Donald Trump sort of softening everything. And maybe it's because he can't quite understand the severity of what's going on. Maybe he's not listening to the science. Maybe he's not appreciating the scope. But when he goes out and says, I think it's all going to work out fine, it's sort of like, as Americans, we need to hear it. We need to hear it. If there's something on the horizon we need to be worried about. You don't have to panic everybody, but you certainly don't tell everybody that it's all going to be fine when you certainly know it's not going to be fine. I hear a lot of Trump supporters that say, you know, he's a strong leader, he was dealt this situation, and he's handled it the best he could, or even he handled it bad, but he's our president. But he didn't. This is a perfect example of an opportunity where you start to let the people know the truth. And when you don't let them know the truth, they're unprepared for when tragedy strikes. And this was just another point. He did this on multiple occasions where people had to have their spider senses tingling and they needed to be aware. Their president was saying, don't worry about it. It's going to be gone. So somebody who might have interacted with somebody with COVID-19 in the future after he said that said, I don't need to worry about it. Whereas maybe the president would have instilled some sort of situational awareness that would have kept them from getting COVID-19 in the first place. Words have power and influence, especially from the President of the United States. Anyways, that same day, WHO names the disease COVID-19.
We now have a name for the disease, and it is COVID-19.
Now, this is another sticking point. COVID-19. Why did you name it COVID-19? Well, they gave it a moniker, just like SARS or MERS or Zika. Naming a virus based on the locale sort of fell out of favor fairly long ago, and so naming it COVID-19 gives it a moniker. If you guys don't know this, Kellyanne Conway, who is the spokesperson and aide to Donald Trump, the president, went on TV and claimed that 19 in COVID-19 meant that it was the 19th virus, and there was 18 preceding COVID viruses.
Some of the scientists and doctors say that there could be other strains later on. This can come back in the fall in a limited way. This is COVID-19, not COVID-1, folks. And so you would think the people charged with the World Health Organization facts and figures would be on top of that.
So that is just either obfuscation or just complete ignorance, because 19 was the moniker for the year that it was found, COVID-19 in 2019. So the misinformation here is rampant, and that, to me, was one of the most dumb things I've ever heard somebody claim in trying to defend the president against his lack of response to this pandemic. February 12th, Seegene Incorporated becomes the second South Korean company to receive government approval for test kits. The self-diagnosis mobile app, allowing users to monitor health and access information such as follow-up actions and clinic locations, became available to the public.
Through the app, visitors can self-diagnose and report for quarantine if they have symptoms of the virus, and the government can monitor their condition in real time.
The Korean CDC announces stricter quarantine screening measures for travelers from Hong Kong and Macau. And a third charter flight brought about 147 people home to Korea from Wuhan. So, again, Korea, this is why I like to compare it, because Korea and America, they're both trying to work in private industry into the loop and utilize that as a way to control the virus. The next day, February 13th, the Ministry of Health and Welfare announced that it would partner with companies producing test kits and private testing institutions to increase the testing kit supply and daily diagnostic test capacity to 10,000 tests within the coming weeks. So if you multiply that by the population increase, that's the equivalent in the United States to 630,000 U.S. tests. So somebody's opening their business again, or wedding. So if you multiply that by 6.3, you get 630,000 tests a day. South Korea was testing 630,000 people a day if they were up. In the United States on February 13th, just to give you some context, on the same day in America, an interview with Geraldo Rivera, Trump downplayed the threat of the coming pandemic.
It's a problem in China. It has not been spreading very much, and in our country we only have basically 12 cases, and most of those people are recovering, in some cases fully recovered. So it's actually less.
Did the Chinese tell the truth about this?
Well, you never know. I think they want to put the best face on it. So, I mean, if you were running it, you wouldn't want to run out to the world and go crazy and start saying whatever it is, because you don't want to create a panic. But no, I think they've handled it professionally, and I think they're extremely capable, and I think President Xi is extremely capable, and I hope that it's going to be resolved.
February 18th in South Korea. A new COVID-19 patient was confirmed, a member of the Shincheonji Church in Daegu City, known as Patient 31, became known as a super spreader. A massive spike in patients came over the next few days. The patient had never traveled abroad. COVID-19 was now seeing community spread in Daegu. I've been to Daegu. Amazing city. Maybe I'll link to a video of me cycling through Daegu. I'm in a city called Daegu. Gosh, there's a lot of motorized bikes, not bikes, something? What are those things? What are those things? I feel like I'm in a weird scooter-based Twilight Zone. Hi, how's it going? Say hi. Really, really beautiful place. There's also a huge church there. They thought that this virus wasn't going to hit them. They thought they were maybe, quote unquote, bathed in Jesus' blood, to pull a phrase from an American who went to church thinking that she would be protected from the virus in America if she went to church.
Aren't you concerned you could infect other people if you get sick inside?
No.
People who don't go to this
No.
church.
I'm covered in Jesus' blood.
So South Korea, knowing the potential that patient 31 could have, sent the Korean CDC and the Ministry of Health and Welfare to Daegu, a task force, and implemented disease control measures with the local government. So they saw this one case. They knew that the potential was there for this thing to explode, so they sent people there immediately to try to get a handle on it. February 20th, the first death related to COVID-19 was recorded in South Korea.
South Korea has reported its first death from COVID-19. Also, the number of confirmed cases jumped up drastically.
February 23rd, the Republic of Korea increased an infectious disease alert from orange to red, so now they're in red level. Government requested all citizens of Daegu to voluntarily self-quarantine for at least 2 weeks, and anyone displaying symptoms to be tested as soon as possible. They also launched a public reassurance hospital program, which separated respiratory patients from non-respiratory and allowed patients to consult physicians and receive prescriptions virtually. They also started opening up their first set of drive-through testing checkpoints. So it's February 23rd. They are basically at code red. They are testing, they are implementing procedures, and they're separating patients so there's no communication of disease to people who are not having COVID-19. The next day, Donald Trump tweeted. Subsequently, the stock market will take an enormous dive, biggest in history. Subsequently, more people will be infected with COVID-19 in the United States than any other country. So most certainly, the CDC in the United States is not working very smart. February 26th, CDC officials said that the California patient being treated for novel coronavirus was the first U.S. case of unknown origin.
There's a case in your district where it's not explained because they just came from China or they were with somebody who had traveled. Do we have that part right?
That is correct. They call it a community infection or community transmission.
Trump placed Vice President Mike Pence, a man with zero medical experience, zero scientific experience, in charge of the U.S. government response to the outbreak. In a news conference, he said,
The better we're getting, we have a total of 15. We took in some from Japan, you heard about that, because they're American citizens and they're in quarantine. They're getting better too, but we felt we had an obligation to do that. It could have been as many as 42. It was just an obligation we felt that we had. We could have left them, and that would have been very bad, I think, American people. And they're in a process of recovering, with some already having fully recovered. And again, we've had tremendous success beyond what people would have thought. The flu in our country kills from 25,000 people to 69,000 people a year. That was shocking to me. So we're at the low level. As they get better, we take them off the list, so that we're going to be pretty soon at only 5 people, and we could be at just 1 or 2 people over the next short period of time. The country is best and worst prepared for an epidemic, and the United States is now, we're rated number 1.
At this point in time, they had 60 cases were infected in the United States, known. So his 15 number had to multiply by 4 in order to be honest. For those of you that still believe Donald Trump never lies, there you go. And for those of you that think he's very smart, doing things necessary to keep Americans safe, reconsider as well.
Well, an outbreak of the HIV virus in Indiana is spreading so fast, a team from the CDC is now involved, and the state's governor was forced to extend a health emergency declared last month. The health department and the state have not been able to get control of the situation here. What has caused this?
Mike Pence has a poor track record following disease. If you were even going to vet him on his capability to respond or control the apparatus in charge of epidemic response, he would be one of the last choices. And now he's the most important linchpin in organizing the defense. Just keeping myself honest, South Korea at this point is pulling away from the United States with regards to cases. The church case has now spread throughout Daegu, and the United States has 60 cases now, and South Korea has 1,225, and South Korea is also detecting more deaths. So at this point in time, the United States has officially said there's no deaths, and South Korea has 12. They are definitely doing worse with regards to statistics at this time, but they're also testing a lot more, and who knows what that would have revealed had America been testing as aggressively as South Korea. Goyang City began operating a drive-through testing station, the first such station operated by a local government. So local governments are having responsibility for their response, a lot like the United States, delegating response to governors and states. But the overreaching apparatus of the South Korean government is still helping everybody majorly with testing and making sure that everybody is taken care of. So there are certain state control measures, but the blanketed system from the South Korean government overall is grand. The Ministry of Interior and Safety announced a 51.3 billion won, basically with the multiplier, $264.6 million in aid to 17 cities. About equivalent $50 million was sent to Daegu. When I say equivalent, I mean it's increased by that 6.3 multiplier. The Ministry of Economic and Finance announced that the rent cost for small and medium business enterprises would be reduced from 20 to 35% for the next 6 months. The Korean CDC began collecting chronological epidemiological data. Wow, I said that good. Epidemiological. I messed that up on previous recordings. South Korea's political candidates halted political campaigning for the April elections and moved all campaigning efforts to social media and other platforms.
Disinfection efforts have become a new campaign trend. Some candidates are even visiting public playgrounds and cleaning the facilities.
February 28th, just like in the United States, there was primaries going on. South Korea said, no more, we're going online, no more rallies, and no more gatherings of people for politics. And let's help everybody's business out and give them a reduction in their rent. The next day, South Korea hit its peak in daily new cases, with 909. If you increase population to the United States, that would be the equivalent of 5,777. This same day in America, a state health official announced a patient infected with COVID-19 in Washington state has died.
One person with coronavirus in King County, Washington state, has died.
This is the first death due to the virus in the United States. Washington Governor Jay Inslee declared a state of emergency, directing state agencies to use all resources necessary to respond to the outbreak. March 1st, Florida Governor Ron DeSantis declared a public health emergency in Florida. Kentucky, New York, Maryland, Utah, and Oregon follow suit. The Fed cut interest rates by 0.5 percentage point in an effort to jolt the economy. You hear that? The hell is that coming from? Somebody's doing vocal exercises. March 5th, South Korea, the South Korean government announced it would buy 80% of the national mask supply starting March 6th and implement a 5-day rotation allowing only 2 masks to be purchased per person. On that same day, in a Fox News town hall, Donald Trump said,
So it's going to all work out. Everybody has to be calm. It's all going to work out.
But to Catherine's original question, there is a long-term plan if it lasts longer than you think.
We could have a very long-term plan. We hope that doesn't happen, but we have plans for every single possibility, and I think that's what we have to do.
Now, on this note, I think that the president should actually be putting out messages of hope and giving some positive spin, but he also needs to infuse it with reality. We're going to have to fight this thing. You know, it's not going to be gone tomorrow. March 7th, the Korean government announced a GPS-based app for self-quarantining measures. The app monitors locations of individuals who are quarantined and sets off an alarm if they are leaving their designated quarantine location. So, March 10th in South Korea, the Ministry of Education postponed the start of the new school year until March 23rd. In a meeting with Republican senators at the U.S. Capitol, Donald Trump said,
Well, this was unexpected. This was something that came out of China, and it hit us and many other countries. You look at the numbers. I see the numbers with just by watching you folks. I see it. It's over 100 different countries. It hit the world, and we're prepared, and we're doing a great job with it, and it will go away. Just stay calm, but be calm. It's really working out, and a lot of good things are going to happen. The consumer is ready. The consumer is so powerful in our country with what we've done with tax cuts and regulation cuts and all of those things. The consumer has never been in a better position than they are right now. So a lot of good things are going to happen. Thank you very much.
First of all, he should meet with all senators, not just Republicans. This division is part of the reason that America is in this mess today. But again, giving people false hope is different from giving them hope. This is one of the reasons why America is such a mess today and why conflicts and poverty will arise that will stretch on for, in my opinion, a decade, is because of lack of giving it to you straight. It's sort of like the stepfather who gives the kid anything he wants, and then the real dad has to come in and say, you can't eat that. You can't do that. I want you to grow up healthy, so you can't eat all of those cookies. I want you to grow up safe, so you have to wear those pads. And then the kid says, but I like my stepdad better because he lets me do whatever I want. He tells me the things I want to hear. America right now needs that real dad to tell them what they need to hear, not what they want to hear.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction, that COVID-19 can be characterized as a pandemic.
That same day, Trump in an Oval Office address.
Today, the World Health Organization officially announced that this is a global pandemic. we will be suspending all travel from Europe to the United States for the next 30 days. These prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval. Testing and testing capabilities are expanding rapidly day by day. We are moving very quickly. The vast majority of Americans, the risk is very, very low.
What this did is it created a huge chaotic situation and bottleneck where people in Europe and all around the world were trying to get back to the United States because they thought they weren't going to be able to.
Overnight, those new tighter travel restrictions went into effect, banning foreign nationals coming from some European countries.
The White House later clarifying this was for foreign nationals, not American citizens and residents.
Especially frustrating for Americans overseas who can't afford to fly back, too.
It is expensive, thousands of dollars.
March 13th, Trump declared a national emergency to free up $500 billion in federal resources.
I am officially declaring a national emergency. Two very big words.
March 16th, travelers who visited Europe prior to entry were instructed to minimize movement, adhere to personal hygiene measures, and keep watch for fever or respiratory symptoms for the next 14 days. So South Korea is telling people that are already here, not even at the airport, already here, if they've come into Europe prior to arriving in South Korea, you have to watch your symptoms and minimize movement for 14 days. The same day, March 16th, Trump issues an order to control the spread of the virus in the United States.
We'd much rather be ahead of the curve than behind it, and that's what we are. Therefore, my administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel. If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation and we will defeat the virus, and we're going to have a big celebration all together. With several weeks of focused action, we can turn the corner and turn it quickly. A lot of progress has been made.
If you were to talk to any scientist or virologist, if you were to talk to other country leaders that were handling this thing well, they would say that is a total and utter lie, giving people false hope for a quick recovery. Also on the same day, on March 16th, we had been spending the entire time in Detroit after our quarantine on a personal level. And when we saw the action, you can watch my videos every day. We knew what was happening in China, what had happened in China. We had seen the news every day in the United States, and we were just kind of in disbelief. What a problem. It just seems like if it does go bad, America is going to be caught without the proper footing. We put our resources together, and we caught a flight out of the United States back to China. When we arrived back to China, we quarantined for 14 days. We were met at the airport by hazmat covered workers, people with very little skin exposed, if not any exposed skin, who put us in a quarantined bus that was separated by plastic from us, from the driver, took us to a quarantine hotel where they gave us separate rooms. My wife and daughter were in a different room. I was in a different room, and we had to spend the next 14 days in isolation. I recorded videos during that period. It was what you would think of as a very serious response to controlling this pandemic now. When we left from O'Hare Airport, the same airport we had landed from, the ticket counters were not wearing masks, were not dressed in any sort of protective manner. There was no glass separating them from the travelers. Nobody that I could see that was set up to have anybody in hazmat suits. The only people that seemed to be prepared were the Chinese people that were flying with us back to China, who were leaving out of frustration and fear that they thought the United States was going to be the beacon of stability with regards to handling this pandemic. But it turns out that China now had been handling this virus and rates had been under control because of how much work they put into management. And so we were going back to China because we felt that was a safe move. March 17th, 2020, Trump talked to reporters.
I've always known this is a This is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. No, I've always viewed it as very serious. There was no difference yesterday from days before.
Now, there's two possibilities here. Either he is telling the truth and he knew it was a pandemic, which makes him a sociopath, or he's lying, which makes him woefully ignorant and ill-equipped to even dream about being president of the United States. If you knew it was a pandemic before it was a pandemic, but you didn't act on actions required if you had a pandemic, then you are liable for the lives and the economic loss brought on by this virus. If you were smart enough to know it was a pandemic from the very beginning, and you acted the way that you acted and put America's economy, its future, its lives in danger, then you are a danger. This quote is insane, and not enough attention is directed towards these things. I think that there's such a cacophony of things that come out of President Trump's mouth, of the administration's collective mouths, that there's such a pile of garbage that by the time you have some sort of major statement like this, that he thought it was a pandemic long before, but he still acted as if it wasn't even 15 cases going to zero. You're responsible for your actions. But it's so much more stuff comes that we ignore and we forget. And I don't think we should forget. It's damaging. After Trump says he thought it was a pandemic long before a pandemic, on March 18th, the Ministry of Interior and Safety in Korea announced an additional equivalent $264 million in aid to the 10 most affected cities. This Korean CDC advised postponing or canceling non-urgent international travel.
The median income for a single household in the year 2020 is about $1,420 a month. Most of the money will come from the city's Emergency Disaster Management Fund, and any shortfalls will come from the government's supplementary budget.
That same day, Congress passed a coronavirus relief package, and Trump signed it into law. It includes provisions for free testing for COVID-19 and paid emergency leave. But when there's not enough tests, free testing doesn't really help very much. I have family in the medical realm, and I can attest to the fact that even today, there's not enough testing, and Donald Trump is saying the tests aren't even really necessary.
So she tested positive out of the blue. This is why the whole concept of tests aren't necessarily great. Something can happen between a test where it's good and then something happens and all of a sudden she was tested very recently and tested negative. And then today, I guess, for some reason, she tested positive. So Mike knows about it, and Mike has done what he has to do. I think he is on an airplane going to some faraway place, but you'll be able to ask him later on.
March 23rd, the CDC advised all individuals in Korea to observe an enhanced social distancing campaign through April 5th by staying at home, other than going to work, visiting healthcare provider, or purchasing necessities.
Experts say swift action from the very beginning was key. That included social distancing, contact tracing, widespread testing, and they were prepared.
March 24th, South Korea on Tuesday doubled a planned economic rescue package to 100 trillion won. Sounds a lot, but that is equal to about $80 billion.
President Trump asked President Moon Jae-in for some medical supplies to help fight the coronavirus outbreak in the U.S. And Moon responded by saying he will provide maximum support if it is available, if he has any supplies to spare. All people coming from America will be required to self-isolate for 2 weeks, regardless of whether they show symptoms or not. That includes Korean nationals as well, flying in from Korea.
That same day, March 24th, Donald Trump had something to say.
Look, Easter's a very special day for me. And I see it's sort of in that timeline that I'm thinking about. I think Easter Sunday, and you'll have packed churches all over our country. I think it would be a beautiful time.
When you compare this statement to what happened in Korea, it rings so true in a horrible way. The fact that the church in Daegu was the hotspot and growth center for the virus, where things exploded. The numbers at that point in time were so low. It only took one person to go to that church to infect everybody. One of the problems with the coronavirus is that when you sing or project your voice or speak loudly, which is very common in churches, shaking hands, this sort of interpersonal activities, this is an encouragement for the virus transmission. And our cases at this point in time were in the tens of thousands, even at this point. So we are on a steady incline, and he's thinking that false hope is what we need, when a real information is what is more important. The 25th in USA, Congress and the White House agreed on a massive $2 trillion economic stimulus package to offset the economic damage of the coronavirus. If you look at the basics of the ability to come up with $2 trillion to try to save the economy and help people out, the amount that we could spend on other social programs or a million other things is endless. Now, if you remember also previously, I said that South Korea was gaining cases, whereas America was quite low. At this point in time, the numbers switch by a considerable amount. So at this point in time, America is going to start becoming America first in a lot of really horrible ways. The Ministry of Economic and Finance announces rent costs for small and medium enterprises will be reduced by 50%. And rent costs for medium to large enterprises will be reduced by 20% for 6 months. The Ministry of Health and Welfare further postpones reopening of community child care health centers. Now, remember, at this point, South Korea has flattened the curve. This is all happening after they have flattened the curve. So America, we are still on an upward trend. We are almost months away from flattening the curve the way that South Korea has. And they're doing these things after. America is looking at reopening currently, and they're still on the rise. According to the Department of Labor, 6.6 million U.S. workers filed for their first week of unemployment benefits in the week ending March 28th, the highest number of initial claims in history. Globally, the total number of coronavirus cases surpassed 1 million.
The United States has the most recorded infections, accounting for around a fifth of the world's cases.
April 3rd, Donald Trump and his administration are now recommending Americans wear non-medical cloth face coverings, a reversal of previous guidance that suggests that masks were unnecessary for people who weren't sick. Donald Trump has an opinion about this.
The CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time. This is voluntary. I don't think I'm going to be doing it.
Now, I think that America was recommending people not wear masks because there wasn't enough masks to go around. So they were trying to mitigate that problem by saying, they're not really necessary, let's keep them for the medical professionals. But masks work. They worked here in China, they worked in South Korea, they've worked all over Asia. Not only do they keep you from touching your mouth, they keep you from projecting as much juice out of your mouth and intaking as much juice into your throat, keeping the viral load low. Everybody in Asia pretty much understood that. And at this date, to say that it's important to wear it, but the president's not going to wear it, it sort of defeats the purpose. Leaders are supposed to lead, and part of leading is being an example. That's why people say lead by example. So I don't know a lot of my Trump-supporting friends what they think about this. The fact that Donald Trump didn't want to wear a mask as an example of the proper methods to prevent the spread of the disease. But when I heard this, I wasn't shocked because nothing Donald Trump does shocks me anymore. But I was supremely disappointed at an opportunity to lead being wasted.
South Korea has managed to stabilize its number of new coronavirus infections, and now it's working to prevent a second wave.
Recent inbound travelers from overseas who do not comply with quarantine measures may face imprisonment of up to 1 year and a fine of up to 10 million won, which is equal to 8,000 USD. What do you think would happen in America if the American government said that if you violated quarantine procedures, you would be sent to prison for up to a year and fined $8,000. I gotta believe that there would be a ton of civil unrest. And I think that a lot of that is based on the fact that there's so much confusion, so much conspiracy, so much blame going on that the usual amount of American pride in doing the right thing for your countrymen has been replaced by doubt and finger pointing. And if you were to lock up individuals for not quarantining, I think you might have civil war, civil unrest. But in South Korea, people trust the fact that this is something they need to fight against, and so they can understand the need for something like this. Anyways, a couple of days later, April 7th, Ministry of Foreign Affairs announces 126 countries have requested COVID-19 tests from South Korea. So around this same time, the United States has resisted the WHO's test for their own production of tests. The tests that they produced are not producing results on a consistent basis, and they are actually trying to contract German companies to make a vaccine that only Americans will use, and they're sort of bribing this company so that they'll have the only antivirus or first dibs on the antivirus. At the same time, South Korea is doing so well, they've flattened the curve, they have this amazing testing program implemented, that they're sending kits and they're having requests for test kits from 126 countries.
The first of 2 deliveries of South Korean test kits will be shipped to the U.S. tonight following an appeal from President Trump to President Moon Jae-in.
For all intents and purposes, that should be America. We are smarter than this. We should be on the forefront of testing, the forefront of mitigation procedures, the forefront on developing a vaccine that we intend to send to the entire world. But instead, it's just selfishness and anger and lack of trusting the facts, and it's driving America into the ground. That same day, the Ministry of Health and Welfare announces smart devices and internet services will be provided for students from low-income households. So South Korea, after the flattening of the curve, understands that people are hurting, and so everybody in low-income households will have phones and internet so that they can stay plugged in to any updates. They make sure that nobody is left in the dark. April 9th, South Korea's school begins their academic year online.
The COVID-19 pandemic has forced schools around the world to consider teaching students online. And students will log on to one of 2 online class platforms provided by the Education Ministry to check for all attendances.
On April 13th, there's so many cases coming into South Korea from the United States that the CDC imposes stricter immigration procedures for Korean citizens and long-term foreigners arriving from the United States.
The researchers say there are 3 distinct variants of COVID-19. They've labeled them as A, B, and C. They found that the strain in Wuhan actually mutated from an earlier version, meaning that Wuhan may not have been the origin of the virus.
April 14th, South Korea ships 600,000 COVID-19 test kits to the United States. 21 days after President Trump requested the test kits in a phone call to President Moon Jae-in.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there.
So here we go. The blame game takes a new turn. I don't deny that the WHO is corrupt. I have tried to educate myself on this matter, but the WHO is the only game in town with regards to global response to a pandemic like this. If you want to pull funding or try to fix a broken system, why wouldn't you try to wait until after this pandemic is through? The American strategy these days, we'll talk about this more in another episode, is based on a sort of slash and burn mentality. Let me put it to you this way. I haven't done enough research on it, but the WHO has some corruption. I need to do more research, and I'm willing to open my eyes to the extent of that corruption. But they are the only game in town with regards to globally informing and assisting countries during this pandemic. It's selfish to remove funding at this point in time when they're the most needed. Add to that the fact that South Korea was acting of their own accord and utilizing the information from the WHO, and they're not blaming the WHO. Countries that are handling this thing better are not blaming like countries that are handling this thing poorly. What does that say? Does that ring true in any way? So anyways, April 16th, 2020, the Ministry of Economic and Finance introduced a second budget of 7.6 trillion won. They're infusing more money into South Korea's citizens. April 24th.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light. And I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way, right? And then I see the disinfectant where it knocks it out in a minute. And is there a way we can do something like that by injection inside or almost a cleaning?
Coincidentally, shortly after, he said that was sarcastic.
Clarify your comments about injections of disinfectant. They're quite provocative.
No, I was asking a question sarcastically to reporters like you, just to see what would happen.
It was a joke. He was joking with reporters. April 22nd, South Korea. The government on Wednesday committed a further 85 trillion won, or $70 billion US, for the country's worst hit industries. The total investment as of now is $200 billion. As a fun cap to this whole timeline, we're wrapping this thing up. May 1st, 2020, just about a week ago, Jared Kushner, Donald Trump's 39-year-old unelected real estate developer son-in-law and senior advisor to the president, made a statement that sums up how delusional and out of touch the administration in America truly is.
We're really doing quite well with that, and I always find that we see the leading indicators, and often the media sees the lagging indicators, but the leading indicators, our testing, are extraordinarily positive. We're on the other side of the medical aspect of this, and I think that we've achieved all the different milestones that are needed. So the government, federal government, rose to the challenge, and this is a great success story. And I think that that's really, what needs to be told.
It does need to be told, Jared. And it does need to be understood. This was a very long video, and I'm probably going to have to take some time to put it together, but the story needs to be told and understood, and it needs to be given context. Context is so important. If America got this virus transferred to them from China's travelers, and they were the only country, and now they're at 1 million cases plus, and people are dying, and nobody else has the virus, and it's only in the United States, well, that's something that we can look at. But when you see other countries very similar to the United States who have dealt with this in very different ways, what does that say about China? What does that say about the WHO? What does that say about America? The reason that I really want to understand and impart upon you how mismanaged America is in this whole thing is to compare it to South Korea and say, we could be South Korea. We could have 80,000 people walking the streets that are dead today. We could have $940 billion ready to be spent on infrastructure, ready to be spent on education for all or free health care. But instead it's been wasted, squandered by a incompetent administration full of incompetent people doing incompetent things that any patriotic American should look at and feel disgusted by. I'm disgusted as an American. You should be too. Just remember what blame is in this circumstance. Blame is obfuscation. Blame is putting it outside of their own responsibility, when the responsibility for the majority of this goes directly to the countries mismanaging the response. And if you believe in American exceptionalism as I did growing up, then we should be at the top of the list of people taking care of this problem responsibly, not at the bottom. So I am really thankful that you went through this process with me, and I appreciate you hanging around. I know that this was a long road, but I think that it's really important to understand the existing timeline as it stands today. I know some things have changed. I know some numbers are a bit different, but it's really important to know why we got to where we're at and whose fault it is. I don't think that China is blameless, but there's a quantifying of blame. So when you hear news about the source of the virus, about the WHO, about everybody else but themselves, and you hear somebody say,
before we did the right thing, it's horrible what's happened. It should have been stopped. It should have been stopped where it came from, which was China. It could have been stopped easily and quickly, and for some reason they were unable to do it. I think they tried, but it got away from them, I guess.
I think you need to look deeper and see that that is just the most blatant blaming and passing the buck that you could see. I also recorded an interview with a friend of mine who lives in Korea, and the next episode will be that interview. You can see how his life is in Korea and take it from his word, not mine, how things are going there. So that will be the next in this short series of videos about the comparison of Korea to America. I think that we need to keep this in mind. The tally as of tomorrow will be more, so more people will die. Today, Korea didn't have a single death from the coronavirus. So every day, our numbers are going to sky away from where South Korea is today, and we are going to become even more and more and more in the red. Please, I hope this gives you a little bit of understanding of the stark differences. Most of my videos will not be this long. I don't know how long this thing's going to end up, but it's going to be quite long. But anyways, I thought it was important. You guys take it easy. Have a good day. Be safe. And subscribe, share. I think sharing this video would be important for those that are interested to take the time to understand how we got to where we are and how we could have gotten to where we could have been. Like, make a comment. Tell me if I'm wrong. There's always new information. I'm open to being criticized. And look forward to the next interview with my friend from Korea. So thank you very much. Thank you very much. Take it easy. And jayo, guys. Jayo.
It's not over until it's over, while keeping enhanced alertness till the end. We must never lower our guard regarding epidemic prevention.
So we have the best testing in the world. It could be the testing's frankly overrated. Maybe it is overrated.